and today I'll be demonstrating administration of ophthalmic medication. For this skills video, you'll be needing a rag, clean gloves, hand sanitizer, some gauze, the eye medication Timolol 0.25% eye drops, a patient, and a trash bin. The first thing that we're going to do is verify the physician orders. The second thing we're going to do is verify the 6 rights of medication, which are right patient, right drug, right dose, right route, right time, right documentation. Once that has been completed, we'll go onto the EHR or the electronic health record to see if the order matches the medication. Our order states Timolol 0.25% eye drops and still 1 drop in both eyes twice a day. The order and the medication do match, so we can gather our supplies and head over to see the patient. We'll knock on the patient's door. The patient will allow us to come in. We'll close the door to ensure patient privacy. I will then begin to introduce myself to the patient. Hello, my name is Pranita and I will be your nurse today. I will then verify the patient's identity using 2 patient identifiers. May you please verify your name and date of birth. I'll look at their wristband to make sure that the information that they stated matches, which it does. I'll ask the patient if they have any allergies. The patient denies having any allergies. I'll move forward by letting the patient know the purpose of their visit. Your doctor has prescribed Timolol 0.25% eye drops. This medication is used to treat glaucoma. It helps reduce the pressure in your eyes. There are side effects affiliated with this medication, such as dizziness and fatigue. Some adverse effects you might see are shortness of breath or slow heart rate. If that occurs, please let me know immediately. I will let the patient know that during administration of these drops, he or she may feel some burning or stinging. I'll let the patient know that this procedure takes approximately 5 minutes to do. And then I'll finish off asking the patient if they have any questions or concerns. The patient denies having any questions or concerns, so I'll now perform hand hygiene. And I'll apply on my clean gloves. I will ensure that the patient is in a comfortable position. If they're in bed, we can raise the bed up and lower the rails. But the most important thing is that their head and neck need to be hyperextended, like in this position. Once that has been completed, I'll examine the patient's eyes for any gunk or crusties. The patient does have some, so I'll obtain a rag. I'll dampen it up with some warm tap water, and I'll place one clean end over the eye. We're not going to apply any pressure. We're going to let it soak for 1 to 2 minutes. After that has completed, we'll wipe off from the inner canthus to the outer canthus to take off any gunk. This process will be repeated with the other eye. We'll be using another clean end of the rag. Again, it is dampened up with warm tap water. We'll place it over the patient's eye. Let it soak for 1 to 2 minutes. We're not applying any pressure. Then again, we'll wipe it off from the inner canthus to the outer canthus. Once that has been completed, we can dispose of the rag. And we can dispose of our gloves since they're not clean. After that has been completed, we'll perform hand hygiene again. And we'll put on another pair of clean gloves. Now with our non-dominant hand, we'll obtain some gauze. And we're going to place it over the bony prominence of the patient's cheek. I'll keep the gauze in place with my thumb and my index finger. And with my dominant hand, we'll obtain the medication, Timolol 0.25% eye drops. We'll open it up and we'll have the patient look up and we'll instill 1 drop in the lower eyelid. If the patient blinks, then we'll have to redo this whole step. If the patient is experiencing a systemic reaction, we'll take the gauze and place it over the nasal lacrimal duct, and we'll have it there for 30 to 60 seconds. After that has been completed, we'll do the same steps for the other eye. Again, we'll take our gauze and we'll place it over the patient's bony prominence of the cheek with our non-dominant hand, and with our dominant hand, we'll have our hand on the forehead of the patient. We'll ask the patient to look up, and we'll instill 1 drop on the lower eyelid. This medication needs to be 1 to 2 centimeters above the conjunctival sac. Again, if the patient blinks, we'll have to redo the whole process. And if the patient is having a systemic effect, we'll take our gauze and place it over the nasal lacrimal duct for 30 to 60 seconds. After this has been completed, the patient did not blink, so the medication was administered successfully. We can throw away our supplies. Perform hand hygiene. We will thank the patient for allowing us to perform care for them today. And we will make sure that the patient is in the safest position, make sure that the bed is at the lowest position, their rails are up, that their call light is in reach, and we will exit the room. And we will document our findings. In our documentation, will include the patient's name, the right drug, the right dose, the right route, and the right time. We'll also mention if the patient is experiencing any adverse effects and how they are tolerating the medication. Thank you so much.